Our team, Team Change in Newark, New Jersey, has been working to better understand the intersection of two major anchor systems, healthcare and criminal justice. While the COVID-19 pandemic disrupted our initial project, it revealed new opportunities to work at the nexus of these two sectors. As the virus spread across the nation, governors were issuing emergency orders and law enforcement agencies were charged to enforce them. In response to public health emergency orders, our team decided to create a public health school to provide the community, specifically those caught violating public health ordinances, with critical information about COVID-19 in lieu of jail time or fines. The public health school is a dynamic and flexible didactic presentation that can be delivered either virtually or in person and tailored to meet the needs specific to individual communities and jurisdictions.
It is important to note that this specific version of a public health school was created in response to already established criminal penalties for violations of public health ordinances during the pandemic. It is not an endorsement of using law enforcement or the justice system to promote compliance with public health related policy and law. While we understand that state officials were forced to take action swiftly with very little information about the virus, we believe that education and community engagement are the most effective ways to ensure compliance with public health ordinances. In instances like the pandemic, where public safety is promoted through healthcare practices and not the criminal code, compliance is best achieved outside of police precincts, courtrooms, and jails. Using the legal system as the primary driver for policy enforcement risks increasing existing racial disparities in both health and criminal justice systems. This group was designed to mitigate the adverse impact that justice involvement would have on those who are already issued tickets and being processed through the system. We wanted to provide options to the court so that they were not forced to rely solely on jail time or fines during a health and economic crisis.
At the bottom of the poster, you will see a timeline starting in March of 2020 when COVID-19 was first detected in New Jersey. It highlights milestones of the pandemic's spread, the court's operations, and our public health school. In early April, it was announced that violators of the emergency orders would be criminally charged. In New Jersey, that means up to 6 months in jail and a $1,000 fine. By the first week of May, just 7 weeks into the stay-at-home order, over 2,000 tickets were issued in Newark alone. We knew that eventually these cases would make their way through the municipal courts. The public health school, therefore, has 3 core objectives. First, educate participants about COVID-19 symptoms, how it spreads, and how to stay safe. Second, strengthen coping skills and resource navigation by teaching stress management techniques and reviewing local health and social service resources. And third, empower participants to act as public health champions in their community by reviewing communication techniques and challenging them to share what they've learned with friends, family, and neighbors.
In May and June, we met with criminal justice stakeholders across the state to propose using this group as an alternative. It was recognized as a suitable alternative to jail time and to fines. The group launched in August when citations began being processed, and we continue to offer it bi-weekly for individuals who are either cited for an emergency order violation or arrested on another low-level offense. Individuals who had only a COVID citation are able to complete the group as a standalone court mandate. Those who had a COVID violation, in addition to other criminal matters, completed standard diversion through community court, and with the public health school being one of those mandates. To date, 97 people have completed the group as an alternative to prosecution for emergency order violations and other low-level offenses. We've been evaluating the impact of the group, making adjustments to content, and seeing how a public health school can help to address health and quality of life cases that are seen through the court system. Many of these low-level offenses draw parallels to the social determinants of health and may be best resolved through education and social service, not fines and jail. Through this experience, we have learned that a public health school model is an effective way to increase compliance with public health ordinances. Participants were engaged throughout the group, inquisitive and committed to making behavior changes such as increased mask wearing, increased hand washing, and communication with others about what was learned. Group facilitators noted that participants were particularly interested in the stress management portion of the group, suggesting that additional supports are necessary to address the mental health impacts of the pandemic. Court partners were strong advocates in using the group as diversion for appropriate cases. The chief public defender in Newark said, "I see this as an opportunity for clients to resolve their cases while being educated about COVID-19. So many individuals in our community were not aware of the new public health policies and the impact COVID-19 had on the city." While this particular iteration of a public health school was implemented during court processing and after law enforcement's involvement, the public health school model can be employed at varying legal system intercepts to minimize or even eliminate criminal justice interaction for particular violations. This pandemic is not over, and the public health school reveals an opportunity for community health workers, health institutions, and the criminal justice sector to work together to improve health outcomes and minimize unnecessary police interactions.